Good day to the viewing and the listening public. This is the COVID-19 update for Monday, April 19. I am Godfrey Brooms, and with me is the Minister of Health, the Honorable Dr. Frank Anthony. Minister Anthony, thank you for joining me today. Let's commence with a brief update on the COVID-19 vaccination campaign. To date, how much persons have been vaccinated for COVID-19?
So as of yesterday, we had approximately 86,601 person who was vaccinated across Guyana. We had a good weekend, I would say, because we had a number of outreach teams in all the regions working to get vaccines out to the various communities. And I think the response has been very good throughout Guyana.
Thank you, Minister. Can you provide us with any kind of breakdown, either by gender or regions, for the persons vaccinated?
We have the breakdown, I just don't have them here. And maybe on the next occasion, we'll try to get the regional breakdown for you.
With the age range being dropped to 18 years and over, the public is worried, some persons in the public rather is worried that we may not have enough vaccines to vaccinate everyone. There are also talks that we don't have the second dose available for the Sinopharm and the AstraZeneca. Could you shed some light on this?
So in terms of as you know, we're using 3 different types of vaccine. We have the AstraZeneca vaccine, we have Sinopharm, and we have Sputnik V. With the AstraZeneca vaccine, whatever you use for the first dose, you have to use a similar vaccine for the second dose. And so when we received the 80,000 from India, we used 40,000 to immunize people, and we kept back 40,000 so that every person who received a vaccine, first dose with the AstraZeneca, we have their second dose set aside. Similarly, we got 24,000 doses of AstraZeneca from COVAX, and we gave out 12,000 and we kept 12,000. So when people are ready for their second dose of the AstraZeneca, we will have those doses available. We have been using a protocol where the interval between the first dose and the second dose would be 12 weeks. So a lot of people would have, once they receive their first dose AstraZeneca, they'll have to wait between 8 and 12 weeks to get their second dose. In terms of the Sinopharm vaccine, again, we received 20,000 and we kept back 10,000 and we gave out 10,000. So again, persons who receive their first dose, they'll be getting their second dose. And because it was a short duration of 28 days between first and second dose for the Sinopharm vaccine, already about 900 persons would have received their second dose of the Sinopharm vaccine. Sputnik V, we started rolling that out quite recently. And again, we are keeping second dose for the persons when they'll need the second dose. Now, with Sputnik V, it's a little bit different from the other vaccine because the first dose is one type of vaccine, and then the second dose is a different one. So the second dose differs from the first dose. It's not the same vaccine that you'll get after a couple of weeks. It's a different vaccine. So we have dose vaccine for the second dose, which is a different vaccine. We have that also available. So again, when persons would be ready for their second dose with the Sputnik V, we'll have those doses available. So I don't think there should be any worry pertaining to whether you'll get both doses, because we have set aside your second dose.
Thanks, Minister. The last batch of the ordered 200,000 doses of the vaccine from Russia, the Sputnik V, it is expected this week. What day are we expecting the arrival, and how will the vaccines be distributed?
So as you know, we have bought 200,000 doses of the Sputnik V. and that's the 200,000 doses of the first component or first dose, and 200,000 of the second dose. So with these two, we'll be able to fully vaccinate 200,000 people, right? We have received the first shipment of those first doses, and today we will be receiving 43,000 of the first dose. So that would complement what we have already received as first dose. And we'll be getting 40,000 of the second dose. So that those persons who would require their second dose, we'll have those second dose ready. And then we're expecting another batch of the vaccines shortly. So the vaccines are going to come in tranches, and as they come, we'll continue the distribution. So coming back to something that you asked earlier, whether we have sufficient vaccines for everyone, our plan has been and continues to be that we are securing vaccines for every single adult in Guyana. So there would be a vaccine for every adult in Guyana. And while we secure the vaccine, it is still voluntary, so people can decide whether they want it or not. Of course, we would prefer that people come forward and get their vaccine, because this is what is going to protect them from getting sick with COVID.
Minister, would government order more vaccines from Russia once they are available?
Yes, and we have, because even with the supply that we currently have, there's still a gap, and we are making those arrangements to ensure that we have enough vaccines to cover our adult population.
And we would have ended last week with the 18 years and older being vaccinated or being able to access the vaccine. What has the response been like?
The response has been good. We have seen a lot of younger people coming forward to get the vaccine. And as you know, when we look at the profile of the persons who are getting sick, we have seen a lot of younger persons between the ages of 20 to 35, where we have recorded the most cases, both for males and females. And therefore, these vaccines are certainly going to help to protect them, to reduce the severity of the infection, to prevent hospitalization, to prevent deaths. So it's important, and we are happy that younger people are responding very well to getting their vaccines.
Thanks, Minister. Let's speak a little on the COVID-19 vaccines and pregnancy. Is it safe to take the vaccine if you're pregnant or plan to become pregnant soon?
There's no contraindication if you take the vaccine that something would be wrong with you. The reason why some caution was advised was that when they did the vaccine trials, they didn't do them among pregnant women. And that was why some caution was advised that before you use the vaccine, if you're pregnant or you intend to get pregnant, that you should consult with your physician. Now, we know that literally millions of people have been immunized around the world, and they haven't had adverse events. There was only a few cases, very rare cases, where with the AstraZeneca vaccine, and in a few cases with the Johnson & Johnson vaccine, that you had incidents of clotting. But those are extremely rare, and the WHO has advised that the benefits of receiving the vaccine far outweighs the risk of getting any of these clots. So it's the same thing with pregnant women. The benefits of receiving the vaccine far outweigh the risk of developing any clotting incident. And therefore, from the ministry's point of view, there's nothing wrong if a pregnant woman wants to access the vaccine, then she should be given the vaccine. So that has been our policy, but if the person would like to consult further, they can consult with their physicians to make sure that they're properly advised.
Minister, do we have any information to suggest if the vaccine would prevent further pregnancies?
No, and that's, we have heard that as a myth circulating, and that's absolute nonsense. It doesn't prevent you from being infertile. You know, there are lots of vaccines that have been in use, and none of these vaccines have prevent people from, you know, being infertile. So this, we have heard these rumors, and we would like to dispel them because there's no truth in it.
And Minister, can mothers who are breastfeeding take the COVID-19 vaccine?
Sure. There's no contraindication for mothers breastfeeding not taking the vaccine.
And lastly, Minister, can a mother transmit COVID-19 to her unborn child?
There have been in the scientific literature maybe one or two papers that have been written about what is called vertical transmission. But that has not been very widespread, and that's something that we'll have to continue to monitor and to see how widespread is that. But they have been in the scientific literature one or two cases that have been where they have written about this. But we still need additional information.
Thank you very much, Minister.
Thank you very much for having me.
This has been the COVID-19 update with the Minister of Health, the Honorable Dr. Frank Anthony. For more information, you can visit our website at dpi.gy.gov. Godfrey Brooms saying goodbye for now.